Hey there, viewers! Do you find it difficult to control your anger? Do you experience angry outbursts with no apparent cause? What about frequent mood swings? All of these could be symptoms of borderline personality disorder. Borderline personality disorder is often confused with bipolar disorder. Unlike borderline personality disorder, the mood swings of bipolar aren't triggered by interpersonal conflicts. In today's video, we'll discuss borderline personality disorder in detail. What is it? What are its causes? What are its symptoms and treatment? We'll talk about all of these and more. What is borderline personality disorder? Borderline personality disorder, or BPD, is a mental illness that usually develops during your adolescence. The usual signs of BPD are emotional instability, the inability to maintain relationships, a slanted image of oneself, and impulsive behavior. According to experts, close to 2% of adults in the US suffer with BPD. Not only is it stressful for the patients, but also their families. On a scale of 1 to 10, how would you score yourself in terms of your ability to maintain long-lasting relationships? Share your answers with the bestie community in the comments below. What causes BPD? While research is still ongoing, there are many factors that contribute to BPD. For instance, a study conducted on twins and BPD showed that genetics may contribute. The environment a child grows up in also plays an active role in BPD. If you grow up in an abusive or neglectful household, your chances of developing BPD are quite high. The other cause could be hormone levels in your brain. If there's an abnormality in production of serotonin, BPD is a possibility. Who's at risk? If you already have a family member suffering from BPD, there's a pretty high chance you'll develop it yourself. Remember, genetics may play a role. If you had an unstable childhood, you're also at risk. Those who were emotionally abused as children are likely to develop the disorder. Similarly, if your family members behaved impulsively while you were growing up, you tend to behave the same way as well. Looking for answers on all the latest health and wellness news? Hit that subscribe button and join our millions of followers. Stay up to date on all our great bestie content. BPD symptoms and diagnosis. There are various signs you can look out for if you feel you might have BPD. For instance, if you find yourself trying to fight abandonment issues, a borderline personality may be your problem. People with BPD usually have a hard time staying with their significant other. If your love life has been plagued with unhappy relationships, BPD is a possibility. Your self-image can also give away signs of BPD. People with this disorder generally have a false sense of self or an unstable identity. In extreme cases, they may even be suffering from suicidal thoughts. This is where it's important to talk to a professional or reach out to a loved one. Another sign of BPD is acting out of impulse. This usually happens in two extreme ways: spending and drug use. People with BPD often spend large amounts of money and abuse substances. If you display signs of mood swings on a regular basis, it's another sign to look out for. Usually these mood swings last a few hours, but in some cases go on for a few days. People with issues controlling their anger may also be suffering with BPD. You may notice their anger comes out of the blue with no apparent cause. They feel angry almost all the time and often get into shouting matches and fistfights. For those suffering with BPD, severe disassociation is another symptom. Your mind feels like it's completely outside of your body and emotions. You also feel paranoid, like a person is always watching you. For a person to be diagnosed with BPD, they need to display at least 5 of these signs. If that's indeed the case, they will be referred to a professional for further diagnosis. Before we move ahead, here's another video you might like. As I said earlier, BPD is often confused with bipolar disorder. They're not the same. Check out our video on what it means to have bipolar disorder. Now back to our discussion on BPD treatment. So, what's the treatment? If you do get diagnosed with BPD, there are various forms of treatment your health professional will suggest. Number 1, psychotherapy. This is one of the preferred treatments. Your mental health professional will have various therapies they can utilize based on the severity of your condition. For instance, your mental health professional may try cognitive behavioral therapy, which is used for those who have an unhealthy and inaccurate perception of themselves. CBT helps you react to unhealthy situations in a way that doesn't make you feel irritated or angry. The other form of psychotherapy is something called dialectical behavior therapy. With DBT, you'll be taught how to recognize when your beliefs and behaviors are not healthy. The therapy teaches you to respond in a healthier manner. The third kind of therapy is schema-focused therapy. With this, the idea is to help you view yourself and the rest of the world in a positive manner. Number 2, medication. This is also an efficient way to treat BPD. Just know that there is no medicine that can completely cure the illness. What medication can do is reduce the symptoms you're displaying. Usually, your doctor will prescribe you antidepressants when you're suffering from depression. You also may be asked to take antipsychotics for any aggressive behavior. Medication is not prescribed on its own, though. It's usually recommended along with psychotherapy. Number 3. Hospitalization. If your symptoms appear too severe and it's likely you may harm yourself or others, you may be asked to stay in a hospital for a little while. This is so they can keep an eye on you while prescribing the necessary treatment. Complications of BPD. When you have BPD, there are other disorders you may also trigger. For instance, with BPD, there's a higher likelihood of depression and anxiety. Eating disorders and substance abuse are also very likely. You might even end up with bipolar disorder. For those suffering with BPD, personal problems are never far behind. For instance, your inability to control your emotions may cause workplace problems and affect your career. Similarly, you could have relationship problems. This is due to your troubles maintaining a connection with your partner. You may also end up in an abusive relationship. Self-injury and suicidal thoughts are other complications you face with BPD. Because of your unstable emotional state, you may end up getting into a car accident. This happens when you're distracted by other thoughts. Since BPD also affects your ability to control your anger, you may find yourself in a fight. This can either be with a complete stranger or even a family member. BPD may sound bleak. In many ways it is, but following the prescribed treatment can help you reduce the severity of your symptoms. Don't lose hope. Speaking of mental health, anxiety and depression are two of the most common mental illnesses. High-functioning anxiety can make you do things you don't even realize you're doing. This is why it's important to spot problems in time and get help. Let's keep the conversation going with a couple more videos, shall we? Check out 5 signs of depression that should never be ignored. You can also try 12 things you're doing because of high-functioning anxiety. Go ahead, click one, or better yet, watch both and learn more about how to treat mental illness. Did you know about borderline personality disorder before watching this video? Let us know in the comments below.